Today we'll be discussing the Comprehensive Metabolic Panel, or CMP. This is one of the most commonly ordered blood tests and provides an overview of a patient's metabolic and organ function. The CMP gives us insights into electrolyte balance, kidney function, liver function, and blood glucose. And by evaluating these values together, we can detect early signs of disease or monitor chronic conditions. The CMP includes a group of 14 tests. These cover things like electrolytes, such as calcium, chloride, potassium, sodium, and carbon dioxide, along with glucose. It also includes kidney markers such as BUN and creatinine, and liver markers including albumin, alkaline phosphatase, ALT, AST, and bilirubin, as well as total protein. Each of these values is important individually, but when interpreted together, they give us more of a complete picture of the patient's health. You may also have heard of a similar panel, but that's smaller, called the Basic Metabolic Panel, or BMP. This is a simpler test compared to the CMP, and you can see the components listed on this slide. Sodium is typically also included. The key difference here is that it focuses more on electrolytes and kidney function, where CMP expands to the liver as well. Blood chemistry analysis is performed to measure the chemical constituents of plasma or serum. Abnormal values can help us detect organ damage or disease processes, but rarely does one test alone give the answer. Instead, we look at patterns across multiple analyses, which requires a good understanding of physiology and pathophysiology so we can interpret these laboratory findings in clinical context. It's also important to recognize that different blood tests require different collection tubes. For example, lavender top tubes contain EDTA, which bind calcium and prevents clotting, making them ideal for cell studies like a CBC, a complete blood count. Light blue tops contain sodium citrate, preventing clotting factors for coagulation studies, and red tops contain clot activators, and these are typically used for serum testing, such as the CMP. We also sometimes call these SST tubes. Choosing the right tube ensures the sample can be processed correctly. We can categorize blood analytes into 8 main groups. First are electrolytes like sodium, potassium, chloride, and carbon dioxide, enzymes including AST, ALT, etc. Third, lipids, cholesterol, triglycerides, and four are metabolic byproducts such as BUN, creatinine, bilirubin, etc. These groupings help us make sense of which each test result tells us about physiology. Continuing our categories, the fifth group is proteins, total protein, albumin, globulin. Sixth are minerals. Seventh, carbohydrates such as glucose. And eight, we have calculated values, anion gap, ratios, etc. These calculations are derived from measured values and give additional clinical insight. It's important to note that normal values may vary depending on the lab performing the test. Each laboratory uses slightly different analyzers and reference populations. However, by applying our knowledge of physiology, we can still understand why certain analytes are linked to certain organ systems. For example, renal function is reflected not only in BUN and creatinine, but also in electrolytes, calcium, phosphorus, glucose, and albumin. A key concept is that each laboratory establishes its own normal or reference range or reference value. These ranges vary due to differences in testing methods, populations, and even patient factors such as age and gender. What's considered normal, excuse me, for a child may be abnormal for an adult. When interpreting labs, we must always compare the results to the specific lab's reference range rather than relying solely on a textbook. When we come back, we're going to look at electrolytes, and we'll start by looking at calcium.